Why is research important in health science? Research is important in health science because it gives us a better understanding, it allows us to make informed decisions, and it keeps medical professionals up to date on new cures and treatments. For our case study, we chose to look at HIV and AIDS. Let's first look at the history of the disease. 1959 was the first known case in the world. In 1985, the first blood test was conducted to identify if you were infected with the disease or not, and in 1995, the first T-cell was explored. How can research be used to make clinical decisions? Research has allowed us to further analyze blood tests to determine an antigen test, a prognostic test, and an antibody test. These three tests can further determine whether someone is infected with the disease or not. Legislations and policies in Canada. There is some legislation that can be applied to people with HIV and AIDS, one of them being the law concerning discrimination in Canada. Research in this field is important to find a cure quickly so that the stigma behind people with HIV and AIDS can be reduced, which would in turn reduce the amount of discriminatory behavior between people with the disease. In conclusion, unfortunately there is no cure for AIDS yet. Advancements in detection and possible vaccination ideas are around, but we need to continue research in order to combat the disease. Research is important in health science because without research, we cannot find a cure. Thank you for listening to our presentation.